One asymptomatic case. 4 people are cured and discharged from hospital. Since this cluster outbreak occurred in Xinfadi market on June 11th, Beijing reported 335 locally transmitted cases. 320 people are hospitalized. 15 people are discharged and cured from the hospital. 31 people are under medical observation. According to the risk evaluation, on July the 5th, Xicheng, Xiaohongmen district has been adjusted to low-risk regions. As of July the 5th, Beijing has 1 high-risk region and 20 medium-risk regions. Since the cluster outbreak occurred in Xinfadi market on June 11th, on a daily basis, we have sustained a digit number for 8 days. And yesterday, it is the first time that Beijing reported no new confirmed case. And we also have an increased number of cured cases. 0 new case does not mean we have no risks. We have to consolidate the achievement. Right now, the epidemic prevention and control in Beijing is making progress, and we are totally controlling the situation in Beijing. The 74th meeting of the leading group of epidemic prevention and control in Beijing municipality and the 34th meeting of Beijing Joint Prevention and Control Mechanism emphasized that right now, we still have risk of transmission of the virus. We have to stay alert in the epidemic prevention and control work. We have to stay alert and always prepare for the worst scenario and work towards to prevent the import infection and domestic transmission. We have to implement the 4 early measures and 3 prevention measures, clarify our duties to make sure that all the epidemic prevention and control measures can be implemented so that we can consolidate the achievements and restore our work order. Now we're entering into a new stage for regular prevention and control. We have to coordinate work resumption with the epidemic prevention and control. For different markets, construction sites, catering sectors, we have to stay alert in the prevention and control. We have to focus these densely populated areas, confined areas, and the staff dormitories so that we can eliminate all the potential risks. We have to screen out all the production chain of the food and strengthen our efforts to control the traffic in Beijing and improve the transportation efficiency. We also have to focus on the nucleic acid test in Beijing, make sure that we have good quality and efficiency of the NAT. We will continue to do a good job in NAT, making sure that we can conduct 24/7 testing to key groups of population and conduct regular testing to people who want to be tested. And we will mobilize all the resources to make sure that we can conduct effective NAT. We will make good use of the health code and also do what we can for the medical treatment and provide personalized strategy to critically ill patients. At the same time, we have focused on the treatment of the mild cases to increase the cure rate. We have to do what we can to prevent nosocomial infection and meet the needs of the critical and severe cases. We also give the full play for the fever clinics and the community health service center. And also we will standardize the regulation and management of the private clinics to screen out all the potential patients. And also we have to follow up with the Xinfadi-related personnel after the end the medical observation. We will remove people from medical observation by groups. We have to continue to monitor the health condition for people who are under medical observation, provide psychological counseling and services to these people. Start from this afternoon, for Xinfadi-related personnel, we will remove some of these people from the medical observation, and we will transport these people to designated places. By understanding the realities of this group of people, we will transport 45,000 people for the first group. And we have completed the weekend disinfection in Xinfadi wholesale market, and the testing result shows qualified. Also, we have to do a good job in organizing the college entrance examination. And today is the first day of the college entrance examination. We have around 50,000 students coming to the examination hall, and they're embracing the first examination of their life. So this college entrance examination is taking place at a special time, and it also attracts many attention from the public, and all the public facilities will provide support for the college entrance examination. We have to make sure that we can implement all of the prevention and control measures and ensure good ventilation for the examination rooms to make sure that all the staff and the students can stay healthy during the college entrance examination. By taking this opportunity, I hope all of these students can have a good performance in the examination. And today we have representatives from local hospitals and the Beijing CDC to attend our press conference. And they will brief us the latest information about the epidemic prevention and control. Now I would like to give you some introduction about the speakers. They are Deputy Director of Beijing CDC, Madame Pang Xinhuo, the Deputy President of the China-Japan Friendship Hospital, and the National Expert Team, and the Deputy President of Chaoyang Hospital, Mr. Tong Zhaohui. First, I would like to give the floor to Madame Pang Xinhuo to brief us the situation about the epidemiological investigation in Beijing. Friends from the media, good afternoon. Now, I would like to give you some updates on the epidemic situation in Beijing. From 0 o'clock to 24 o'clock on June the 6th, there's no new confirmed cases reported in Beijing, no suspected cases. This is the first time that we registered no new confirmed case in Beijing since June the 11th. On June the 11th, we reported the first confirmed case in Beijing, and we have coordinated all the available resources to conduct epidemiological investigation to this specific case. We are making good use of information technology, and also we are trying to find out the travel history of this patient. And we also identify 38 close contacts for this confirmed case, and identify several public facilities that has been exposed to these confirmed patients. And also, our staff has collected environmental samples from the public facilities and also collect information from the close contacts of this confirmed case. On June the 12th, we found in the transaction hall of Xinfadi wholesale market, the sample was tested positive of COVID-19. And on the same day, we found a second confirmed case on June the 12th. According to the epidemiological investigation, we found that the first patient had visited to the Xinfadi wholesale market. According to our experiences in the epidemiological investigation, we have made a judgment that maybe there may be some virus existed in the Xinfadi wholesale market. And later on, we have a specialized team to collect samples from people who are working in the Xinfadi wholesale market. And on the day, we found 40 environmental samples tested positive, and also we found 45 people tested positive through the deep throat swab. And all of these samples are actually collected from the basement of Xinfadi wholesale market, and people who are getting infected also salesperson who are working in the basement of the transaction hall. And also, we found some of the close contacts they used to visit the Xinfadi wholesale market. And later on, we confirmed that the risks is actually existed in the basement of the Xinfadi wholesale market. So it takes us less than 22 hours to identify the source of infection. And this is thanks to the immediate actions taken by the leading group of epidemic prevention and control of Beijing municipality, and immediately we locked down Xinfadi market, and also several nearby communities are under lockdown. And also we are sending relevant persons into designated places for centralized quarantine. And also we are conducting a very detailed epidemiological investigation to all the suspected cases and filling all the loopholes for the epidemic prevention and control. For all the close contacts, we send these people to centralized medical observation. For different districts, communities, and all sectors of Beijing, for people who have been visited the Xinfadi wholesale market, we conducted a large-scale screening and require these people to do a home isolation. At the same time, per requirement and suggestions of the National Health Commission, Beijing municipality have decided to take a series of policies and improve our capability in nucleic acid test, and we also extend the scope of nucleic acid test. And to key groups of people, key areas, we are making sure that all people can be tested and screened as required, and also we will roll out the NAT to people who want to receive the test. And right now we have 184 hospitals and medical institutions are able to provide the NAT. And right now the daily capacity can be increased to 500,000 samples. Right now, the epidemic prevention control have made some notable progress in Beijing. I would like to send out a reminder to all the public. Zero increase of new case does not mean we have zero risks. Right now, we still have some people hospitalized, and also we have some asymptomatic cases. In the upcoming few weeks, there may be possible that we have some confirmed cases in Beijing. So please stay alert and mind your own hygiene and respond to the requirement of epidemic prevention and control. Discharge your duties in the epidemic prevention and control for different communities and companies. Please work together and join hands and take science-based approach and move forward with our efforts for the epidemic prevention and control so that we can consolidate our hard-won efforts and achievements. And this morning, actually, in one of the examination for the college entrance exam, we are seeing that the Beidou system is comprised with 55 satellites, and actually for the defensive line in Beijing for the epidemic prevention and control is comprised of the efforts made by each one of the Beijing residents. We have to join hands to win this battle against COVID-19. Thank you. Thank you for Madame Pang's introduction. Now I would like to give the floor to Mr. Cui Yong to brief us on the medical treatment that has occurred in the China-Japan Friendship Hospital. Friends from the media, good afternoon. Right now, on behalf of the Friendship Hospital, I would like to give you some update on the epidemic prevention and control work conducted by our hospital. Since the outbreak of epidemic, the Party Secretary Committee have attached great importance to this issue. Through arrangement of the leading group of epidemic prevention and control of Beijing municipality, we always put people's health and safety as our top priority. We prepare for the worst scenario, and also we have improved our awareness. We have put equal emphasis on epidemic prevention and control and medical treatment. We have given full play to the medical institutions to contain the COVID-19. As of June the 30th, we have received over 22,000 fever patients and also received over 1,400 severe cases and critical cases. So we are actually the front runner in terms of medical treatment. At the same time, we realize zero infection of medical workers. We have focused on several measures. We have provided 3 tiers of treatment in our hospital, and also we are doing a close-up management in different fever clinics in our hospital. So especially we will roll out this lockdown management for the respiratory department, and also we are organizing an expert team, and these people will be working on a shift basis so that they can provide services to the patients. Second, we also set up a buffer zone. We are setting out 4 wards comprising with 60 beds. Since the outbreak in Xinfadi, we also expand our capacity of our wards so that we can receive more patients. And third, for different parts and different sections of our hospital, we have strengthened our management to reduce the risk of cross-infection. We also adjust the admissions requirement for different wards, and making sure that no other people will visit the patients during the epidemic. At the same time, we're providing some humanitarian services to our patients. We set up only one entrance and exit for each one of the wards. Also, we provide support to the patients so their relatives can visit these patients through internet. And also we open up a special channel to support the severe and the critical cases. In order to support the rescue of the severe and critical cases, we are providing 24/7 testing to these key groups of people, and these people can receive the testing result within 6 hours. And third, our hospital have improved our capability in nucleic acid test. As a demonstration site for the nucleic acid test, we have improved our capability of the nucleic acid test. So we are able to provide the testing result within 6 hours. On June the 11th, we are also receiving support from other provinces. And on a daily basis, we are able to handle the samples with 10,000 samples per day. And some of these people are tested positive from our NAT. And at the same time, we are also setting up mobile NAT sample collection sites so that we can make sure that we can conduct regular testing to people who want to be tested. And also we are separating these people with the key groups of people. By doing that, we can reduce the risk of cross-infection. And also we are rolling out NAT to around 5,000 students. All of the results show negative. At the same time, we are dispatching a group comprising with 30 nurses, and these people will collect samples from different communities. By July the 2nd, we have collected 30,000 samples from the communities and from the public. And also we are making good use of an internet service. And also we are building up a platform to provide a cloud service to patients who are with severe and critical conditions. And also we are providing drug delivery services to the public. We're improving our information system. We are working with the pharmaceutical companies. And we are able to deliver drugs to over 300 households. All of this work have been highly appreciated by the public. And also we open up a green channel that allowed people who want to be tested. And also we are setting up a contact list medical service. We are setting out 20 windows to receive the patients. And also we are setting up different platforms and service desks so that we can better serve the patients. a series of medical service facilities were set up during this period of time. Going forward, we will respond to the requirement of the normal prevention and control in Beijing, and we are making sure that we can place equal emphasis on the medical treatment and the epidemic prevention and control. We will fully discharge our duties as a national team and contribute to the epidemic prevention and control in Beijing. Thank you. Thank you for Mr. Choi Yong's introduction. Now is the Q&A session. Please identify yourself before you raise the question. With China News Service, my question is to President Tong. So for the general public, so what areas shall they pay attention to when coping with patients that have just recovered from COVID-19? So first of all, thank you for your question.
新冠肺炎患者实际上我们大家应该知道，多次指示要继续做好新冠肺炎。
We have received the guidance from the central government that we have to provide psychological counseling to the patients. So this actually extends our treatment to our people, meaning that we have emphasized the safety and health of our people. So for the general public, we have to show care to all of these COVID-19 patients, especially to those patients who have recovered from COVID-19. So for COVID-19, it is actually a viral pneumonia. The differences between this kind of pneumonia as compared to others is that it is contagious. But if we can find these patients in early stage, so they can be treated at an earlier stage. So for patients who have recovered from COVID-19, they will not pass the virus to others. So for their neighbors, their friends, their family members, they should not discriminate these patients. Instead, they have to provide more support and care to these COVID-19 patients, especially the recovered patients. At the same time, we have to educate the public about the knowledge of the COVID-19 so that it can eliminate some of the misunderstanding about the COVID-19. Thank you. Last question. With Transport Radio Channel, my question is also to Mr. Tong. And you have talked about the confirmed patients, suspected patients, and asymptomatic patients. So what will be the differences for the treatment to this group of people? And you were talking about now we have around like 30 asymptomatic cases. Why shall we keep these people into the asymptomatic group as opposed to the confirmed cases? So this is a very technical question. Actually, in the 7th edition of the treatment guidelines, we have a clear definition to different groups of infected patients. For suspected cases, these people have some respiratory symptoms. For example, they may develop symptoms of coughing, and they may have some pneumonia-like symptoms. So for some of the patients, we also have to understand their CT scans. We have to check their blood cells condition. By analyzing all of these information, we can identify this group of people can be clarified as the suspected patients. That is to say, if any of these patients meet some of the standards that has been identified from the epidemiological investigation, so these people may be included into the suspected cases. And for some of the patients, we also have to look at their antibody testing. And as for the confirmed cases, so first we have to understand the suspected cases, and now we talk about the confirmed cases.
同时具备以下病原学
So
和血精学的证据，比方说
confirmed cases, they also have to
荧光 RT-PCR 检测新冠
shown positive in their PCR
我
test.
们临床把它怀
So if we have their test results, we can clarify these people as confirmed case.
那么第二个就是病毒的基因测
And
序
also we have to
已
understand
知新冠病毒
the
的高
gene
度同源
sequencing of the
第三个
virus.
就是新冠肺炎病毒特异性的 IgM 抗体和 IgG
And
抗
also
体
we
的
have
谱系
to
第四是新冠病毒的特异性
Find
IgG 抗体由
to
阴
look at
性
their
转为阳性
antibody
或
testing.
者是
So for the confirmed
恢复
patients,
期较
the
急性期
IgG and the
4倍以上
IgM
升高
also shows positive. So this is also some of the evidence that can
它的一个确认病例
make
实
these
际上
people
我
into
作为
confirmed
临床
patients.
大夫我觉得在这儿应该强调一点各个医
So
疗
as a
机构
doctor,
应
I
该
would like
重视
to
疑似病例
remind
的
all
去
the medical institutions. So
我
at this
们只有
stage, we have
发
to
现和
focus
甄
on
别
the
出疑似
screening
病
of
例
the
才
suspected
能
cases.
进一步
Because
去
first we
甄
have
别
to
它是否是
identify the suspected group, and later
确诊
on
病
we
例
can
同时呢疑似
identify
病
the
例我
confirmed
们应
cases
该要
out of
要把它
the
相应地
suspected
管理
cases.
起来
We also
那
have to
么
manage the
那
group
么
of
疑似病例
suspected
呢鉴
cases.
别以后我们实际上也应该把它作为和确诊病
After
例一
we
样
identify the group of suspected patients, we also have to apply treatment to these people.
那么刚才提到的
And
无症
also
状感
you
染者
talk
实
about
际
the
上包括两
asymptomatic
部分
cases.
人
It
群
actually covers two
那么
groups
一
of
部分是
people.
隐性
So
感染
for the first
第
group
二部分是在
is
潜
the
伏期的患者
covered patients, and the second group people are people who are
它
under
不是患者一般
incubation.
不需要治疗
And for
它只是
asymptomatic
核酸阳
patients,
性它没有
patients
任何症
they're
状
showing
CT 也是正
positive
常的
in
所以说
the NAT.
没有
However,
把它纳入
they're
患
not
者
develop any
也是不需
unusual
要治疗
symptoms for their
更没
CT
有符
scan.
合
So
它
these
这个
people
新
do
冠
not
肺
have to
炎影像
receive
的
any
特质
treatment at this
那么还
stage.
有一部分
But
是
for another group
它
of
刚
people,
开始是没有症状
they're
它是处在一个
actually
潜
at
伏期也就是说它
at
的
the
症状还没有
incubation
表现出
period,
来
so
所以
their
说
symptoms have not yet
这一部分
started
患者我
to
们更应
develop.
该警惕
We
也
have
就是说它
to
早
pay
期
attention to
大
this
家知道
group of
新冠肺炎
asymptomatic
起病比较隐
carriers.
有的病人潜伏期
So
比
we
较
all know
长
that for some
在一段
people,
时间
they
内
may
他
have
没
a
有症
long
状但实
period
际
of
上他
time
就
for
是
the
隐喻的
incubation,
患者
but still,
所以说
this
这个时候
patient
呢
may still
有的
be
地
the
有的呢
confirmed
就把它当作无症状
cases.
感染者实际上它
For
是一
some
个
people at
隐
this
匿
point,
患者
maybe
我们
we
应该观察
clarify
我们应
that
该把
as
它
the asymptomatic
甄
cases,
别
but
出
later
那
on
么
they may
它潜伏
become
过了
the
以后它就出
confirmed
来
case. Because
所
after
以
the
说这些
incubation,
患者呢
these people
他
will
就
turn
不是
into
一个
confirmed
无症
cases.
状感
And
染
this
它
group
是
of
隐藏在
people,
无症状
they
感染
are
者的一个
confirmed
隐匿的患者
patients.
所以我们大家应该
So we
重视
have
所
to
以
pay
往往
attention
是
to
过
this
了
group
几
as
天以
well.
后过了潜伏期以
So
后
for these
出现症状
asymptomatic carriers,
我
some
们
of
就把
them
它
may
归为什么确诊
start to develop symptoms, and these
那么
people
无症
will
状感
turn
染者
into
实际上
confirmed
呢
cases
存
later
在一
on.
定的
For some
因为
asymptomatic
核酸
cases, they
那么从
may
医学上判断
pass the virus to
大多
others.
没有排毒的过程传染力一般比较弱
And for
传
these
染性
patients,
比
they
有
do
症状
not
的
go
居
through
得
the
多
process
所
of
以
the
说不管怎么样我们
toxification.
要继续加强无症状
So
感染者与
it
确
is a
诊病例
risk
的
that
辨别和
these
鉴别
people may pass the
而
virus
且
to
我们要
others.
采取目
We
前的
also
一
have
些
to
管
take
理
stringent
方式
measures
做
to
好传染病
manage
4个
this group of
健康
people.
监测
We have to
可以
implement
有
the
效防
4
治
early
无症
measures and the 3 prevention measures so that we can reduce the gathering and make sure that there's no people getting infected. So that's the end of the Q&A session.